All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
Hello everyone, I am Nikitha and we are back with yet another episode of BMC Global Health World in association with Alhilal Hospital, Bahrain. Today more than ever, health and wellness is in top of our minds. In today's session, we will talk about benign tumor of skin. We have Dr. Vigil Devaraj with us to talk about the same. He is presently working as a general surgeon in Alhilal Hospital with over 11 years of experience. Hello doctor. So today you'll be talking about the benign tumor of skin. So to start with, what is a tumor and what is a benign tumor?
It's referred to a condition where any growth or any tumor or any swelling in our body which are not cancerous, which does not spread to the other part of the body. Usually it is harmless. So these are called benign tumor. The tumor which arises from the skin, that is the benign tumor which arises from the skin, we are called as benign tumor of the skin.
Okay. Doctor, what are the different types of benign tumor of skin?
There are many tumors arise from the skin, but all are treated not only by the doctor, surgeon. There are many treated by dermatologist and many plastic surgeons. So today I am going to discuss the tumors which are commonly seen in my clinic, which are more common in our country. In that, basically, before going to that, we should know little anatomy of the skin. So for that I will tell just an anatomy of the skin. So in that skin you have three layers. First the topmost layer called as epidermis, then dermis and then subcutaneous layer. So epidermis is the outer part of the layer where it acts as a waterproof and which gives the soothing effect or moisture of the skin. Then the layer comes as dermis. So this is the important layer where all the sweat glands, sebaceous gland, hair follicles and vessels, nerves, lymphatics, all these comes from this layer. And the next layer is the subcutaneous layers. So this type of in all benign tumors of skin, it arises from in these three places. So in outermost layer, usually these tumors are cancerous or benign. So for that we should do few investigation. We have to take a proper history so that we can come to a diagnosis. So in this I am going to talk about basically what we see in the OPD. So namely sebaceous cyst, dermoid cyst, lipoma, corn foot, and some swellings which are infective in etiology like abscess, furuncle, carbuncle, and pyogenic granuloma.
Doctor, what causes benign tumor, or like how does it grow?
See, as I said before, few swellings like sebaceous cyst. So this, before telling about that, just I will tell about the sebaceous gland. So this gland is situated in the dermal layer of the skin. So what it will do? It secretes sebum. That is a lubricant, like it's a moisturized thing which protects against the friction. So it gives the soothing effect moisture to the skin. So when this this duct get blocked, you will get this type of swellings. So the reason behind this is, some people say it's because of mild infection or any acne or any rashes followed by this swelling. What will happen is the mouth of the gland will become blocked. Because of that, the accumulation of that sebum will be inside that gland. So it will be there for a long time, and what will happen, it will increase in size and it will become a huge cyst like swelling. Usually it will be not painless, it won't harm much, but still some people will go for infection. So we have to intervene accordingly.
You told about sebaceous cyst. Now what about the dermoid?
So dermoid cyst, there are few types are there, but I am going to talk about only two things, which is congenitally it will come, and another is acquired, it comes in between. So in that first I am going to talk about the congenital one, that is called sequestrational dermoid. So what will happen is, there will be in the beginning of life, when the two bone fuse together, that in that junction this swelling will occurs. So it's usually seen in the scalp, face, midline. So but it will be harmless for a long time, but usually it will be seen in the second or third decades of our life. Usually it will start with very small swelling and it gradually grows in size. Usually it won't be much pain. Sometimes it can go for infection, but these are usually harmless swelling, usually seen in the face and the scalp. And another one is implantation dermoid. This occurs in the finger, toes. This is usually because of frequent prick. Maybe people are working as a gardener, as a tailor, they will have a constant prick in the finger or toes. Because of that, this swelling will come. So this is also a dermoid, but this is an acquired one. So this also be treated conservatively or sometimes need surgical intervention.
Doctor, can you explain about lipoma?
So lipoma, it's called as an universal tumor because it can occur in any part of the body. The etiology behind the thing is we don't know clearly. Some people are telling it's because of hereditary or genetic, but still it's not clear. So what is that? It's a collection of fat in the subcutaneous layer. Usually it will be very soft, painless, it will grow, and it won't make any harm to the patient. Usually it is seen in the nape of the neck, that's back side of the neck, back, abdomen. Sometimes it can be multiple. You can see it in the forearm, and some people you can see it in the face also. So in lipoma, we have to treat accordingly when patient have any cosmetically problem, or if patient have pain, or if it go for infection, or it is very big.
Okay, you mentioned earlier benign tumors are non-malignant, which means it is not that harmful. So if a person leaves some kind of like tumor growth untreated, will it be like harmless?
Yes, the thing is, all tumors no need to treat or no need to intervene immediately, but still depends upon the condition of the patient. See, as I said, there are few tumors like sebaceous cyst, dermoid, lipoma. Initially it will be very small, it won't harm anyone, but the people who have like diabetes or any autoimmune disease, people will go for infection. So recurrent infection will be there, and patient will go for pain, and sometimes there will be discharge from that. So for that reason we have to intervene as soon as possible. Before doing the procedures, we have to confirm the diagnosis with various investigations and various techniques. After that only we will go for procedure.
Every piece of jewelry tells a story. Its raw beauty speaks of its natural origins. The brilliant design speaks of unparalleled craftsmanship. Its elegance evokes the passion and energy of those who wear it. At Al Siraj Jewelry, our story, our pride.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
The benign tumors, it can develop in different parts of the body. So what are the common benign tumors and how will you differentiate among them?
As I said, these are the dermoid cyst, sebaceous cyst, lipoma. These are all benign tumors, or we call as benign swelling. So it can occur in any part of the body. For differentiating these things, we have to take a proper history of the patient. In this patient, we have to take a proper history and proper examination. With that, we can conclude what's the diagnosis. We can go for a good diagnosis. For that, we have to first take a proper history so that we can understand what will be the probable cause for this. In that, first we have to know how much duration. Usually they will give you a duration of long period like months to years. So, and the site is very important. As I said, some tumors will come in a particular site. Like sebaceous cyst, it can't come in the palm and the sole because in that place there is no gland. So we can rule out that if any swelling from the palm or sole, that is not a sebaceous cyst. And as I said, lipoma usually seen in the nape of the neck, backside of the neck. If any swelling arises from the neck region, we can suspect lipoma. In sebaceous cyst, you can see one black mark, like a small dot like thing will be there. That is called punctum. So with that we can diagnose this is more chance for a sebaceous cyst. So with the clinical history, with the examination, we can come to some diagnosis.
Patients may experience a wide range of growth and changes during their lifetime in their skin. So as a doctor, how do you differentiate between a malignant tumor and a benign tumor?
In the skin, right? So the thing is, usually we will, as I said, we have to take the proper history. Usually benign tumor will be grow very slow. It will take months to years. But if it is a malignant or cancerous, it will grow very fast. And the consistency of the swelling, usually in benign it will be very soft or firm, but in malignant it will be very hard and varying in consistency. Then the swelling over the skin over the swelling will be very soft in the benign, but in malignant it will be irregular. Mainly in benign there won't be much pain, but in malignant patient will have pain, and clinically we can find there is a spread in the lesion, like it can goes to the other part. but in benign it won't go to the other part, it will confine to that particular part. So these are the clinically finding things, but to confirm the diagnosis we need many investigation, basic investigation like blood count, and followed by a few investigation techniques like FNAC, like fine needle aspiration of cytology. Then if needed we will go for wedge biopsy, we will take a small chunk of the lesion and will send to the biopsy. Many times we will do excision biopsy, we will remove the full thing and we will send to the lab so that we will get the final diagnosis.
If the patient observes a growth or a lump-like thing on the body with pain and fever, so as a doctor, what will be your conclusion?
So this, if patients comes with the swelling with fever, usually it will be the time will be less than 2-3 days, and they will give you a history like initially it was very small like a pimple and followed by a big swelling. So by taking the exam, by examining the patient and by proper history, we can conclude the diagnosis. In that we need to see the swelling. In that the swelling will be red in color and it will be very warmth, it means very hot, and sometimes you can see a yellow color nodule will be seen on that. It goes more towards the abscess. So what is abscess? So abscess is nothing but a collection of pus inside the body. It can occur in any part of the body. It is usually due to some infection, can due to any trauma or any scratch, or initially to start like a small pimple and it converts into this type of lesion. For this we have to intervene as soon as possible, because they can go for a severe like fever, it can go for septicemia. So we have to do the procedure as soon as possible.
According to what you mentioned earlier, in the diagnosis step, I think probably the first step will be like to identify if it's malignant or benign. What are the other treatment procedures if it's a benign tumor?
As I said, we have to confirm the diagnosis. For that we need investigations. As I said, sebaceous cyst, lipoma, usually physician or surgeon will conclude by the proper history and proper examination, and to confirm the diagnosis we need few investigations. Basically we will do ultrasound scan over the swelling so that we can see the content of the swelling, in which layer the swelling is, whether it is attached to the muscle layer or is going below the muscle or bone. If it goes behind that, we will go for a higher investigations like CT scan, MRI. As I said earlier, before doing any procedure we have to confirm the diagnosis. If still after doing this investigation still you have any doubt, then as I said we have to go for a pathological examination like FNAC, wedge biopsy or excision biopsy to confirm the diagnosis. After confirming the diagnosis, the treatment will be excision and biopsy. So whatever the swelling benign tumor, the treatment is excision followed by biopsy. Because dermoid cyst or sebaceous or lipoma, there is no medication for that. If you take medication for that also, it won't subside immediately, it will be there. So we have to intervene accordingly. It's better go for surgery. It is usually a daycare procedures unless it is situated in a complicated areas like face, neck, sometimes skull. We have to do it under general anesthesia. Otherwise these are done under local anesthesia.
If a person leaves this tumor untreated, are there any complications that can affect them?
Basically the complications are more if not treated, because people, especially people who have diabetes, hypertension or any other immunocompromised disease, they have to treat as soon as possible, because it can spread widely and become infected, and then we have to go for a big surgery like removal of full area and have to come for regular dressing. It will take time. So when it is small, it's better for them to treat as soon as possible, so that the treatment will be also very simple, they will also benefit more. So have to treat as soon as possible. The complications of this swelling if we are not treated.
So doctor, please can you summarize about the benign tumor of skin?
There are different types of benign tumors in the skin, but all skin tumors no need of any surgical intervention. We can treat conservatively, but still we have to confirm the diagnosis and we have to act accordingly, because many people will keep it for long time and will become infectious and will be difficult for the patient and for the treating doctor also. So you have to come as soon as possible. Better you can come and take an advice to your doctor in an early stage, whether to do any procedure or you can treat conservatively, because if you are not treating it properly, it will become worsen and it will affect their daily life activity. So for that reason, better to check as soon as possible.
Thank you, Doctor, for sharing some valuable information. This was really interesting and beneficial to all of us. Thank you so much.
Thank you, Nikitha.
So with that, we come to the end of our program. Hopefully this gave a clear overview of what benign tumor or skin means. I would also like to thank Dr. Vigil once again for making time for us. Please don't forget to like, share and subscribe our Facebook and YouTube channel. This is me, Nikitha, signing off. Thank you.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our stunning collection of fine jewellery, gemstones, pearls and diamonds. Fine pieces in timeless designs and unspoken elegance. Al Siraj Jewellery. Our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
വിഷമിക്കണ്ട, എല്ലാം ശരിയാവും. ലുലു മണി, സ്നേഹപൂർവ്വം.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.